A Call Kurtis investigation found some viewers are struggling to get their pain prescriptions filled.
He's now learned it's impacting some Kaiser patients, and he's getting answers why.
Yeah, well, we just heard from the wife of a Kaiser patient in Auburn who says her husband has a bad knee and needs his hydrocodone for the pain. But she says Kaiser turned him away, saying after taking this medication for over 10 years, he is physically dependent on it. If he doesn't have access to the medication, his body will go through withdrawal. Sound familiar? Well, we told you earlier this month about viewers in Tuolumne and Calaveras counties saying they too were cut off from pain meds. They are not Kaiser patients, but they say they struggle to get any pharmacy in the foothills to fill their prescriptions.
It's only been 4 months, but this 4 months have seemed like years.
And she says she went through withdrawals and decided to get off the painkiller she was taking for 13 years after a motorcycle crash. As the country deals with an opioid crisis, it was challenging to get a straight answer from anybody about why this is happening. But after hearing about this Kaiser patient, we reached out to them. And Kaiser has now given us the best explanation yet of what's happening. Kaiser admits it is changing some prescriptions to reduce opioid use among Kaiser patients to avoid overdoses, addiction, and misuse. But why now? Well, for one, Kaiser says pain management is evolving for patient safety, but also, well, it really has no choice because drug distributors are now limiting the controlled substances they send out. It's something they agreed to do when they settled lawsuits this year with the government tied to the opioid crisis. Kaiser admits the lower supply does require a change in prescribing practices. Kaiser says we apologize to any member who may be affected by limits on the quantity of their medication. Although the goal is to continue to evolve to protect patient health and safety, we recognize that changes in a medication plan can be stressful or confusing and encourage patients to reach out to their physician with any questions or concerns. Now, while Kaiser says it may taper some patients off their medicine, it says it will not impact anyone receiving end-of-life or palliative care. As you can imagine, what's happening industry-wide, it's very controversial. Legal challenges are underway. And remember, we're here to investigate things for you. So if you have a problem you can't solve, go to CBS13.com/Call Kurtis and fill out our form.